Hi everybody, this is Dr. Joseph Baker from the Limerick Chiropractic Center, and you're going to be saying goodbye to hip pain. Tonight we're going to talk about, some of those different situations. Maybe you're an individual who, when they get more active, that pain starts shooting into the side of their hip. Maybe you wake up first thing in the morning, and as you get up out of bed, all of a sudden you get that first round of pain that's unrelenting throughout the course of the day. Maybe you're the individual that the more you move around, the more active you get, the less you feel it. Well, tonight's conversation, you're going to be taking away different things. But in the end, regardless of what category you find yourself in, you are going to be taking away something different. In fact, I'm going to ask you to make sure in the comment section, you leave me questions, you leave me your great takeaways, things that you took away from this workshop that you're going to try, that you're going to use to help improve yourself. Because in the end, one of the things that we recognize that now that you have this pain, well, it was actually the very last thing to come as your body is breaking down, as it's getting more and more inflamed. Only 10% of your body is capable of even transmitting a pain signal. The neurologists have already done the research. We know you have to actually choke off 50-60% of the nerve flow, that communication process, in order for the pain to even begin to be produced. Wow, let's just think about that. We have to be working at less than 50% capacity. Our health level has to be at less than 50% in order for us to even receive a signal to understand that there's an underlying problem that's there. And many of us, if we don't utilize the different tools that are at our disposal to slip and check how our body's functioning, then yes, unfortunately, we will walk ourselves to that point. Now, the sad thing is that once you've walked yourself to destroying the hip joint and destroying it to the point that, not only have you damaged the tissue, but you damaged it beyond the point of repair, sadly, it's going to cost us. The average American is going to spend somewhere between $37,000 and $53,000 on a single hip replacement. It could be as high as $73,000 from everything that I've read online. But let's just wrap our head around that number, $50,000. That pales in comparison, though, to the cost of lost opportunity. Us not being able to do the things that we absolutely love to do. The things that maybe we've wanted to do our entire lives. The trips that we wanted to take. The mountains that we wanted to climb. The hikes with our grandchildren and our children that we're not able to complete. The cost is measured on a lot of different levels. In fact, even once you do have the surgery, it takes weeks before you can be on your own in your own house. But a total recovery, as they have it placed online, could take anywhere from 3 to 6 months. 3 to 6 months. And we talk about that time length because we realize there's limitations. There's things that you can't do. In fact, they want you to wait at least 3 to 6 months after a hip replacement to get the next hip replaced. So we realize there is definitely a cost involved. And when we talk about the causes of hip pain, we could talk about so many different things. And as you can see on these pictures here, the X-ray of the pelvic area, you can see the top of the legs, you can see the hip joints. Let's recognize there's a lot of tissues that are covering over these joints. When you look at the different ligaments that actually help to hold and lock the joint in place, there is still a capsule that's around all that. There's muscles, there's tendons that are going past this area to help facilitate the motion. The structures around these hips of yours are numerous. And we realize that, oftentimes the causes are capable of being numerous, and one of the things that we see with our patients is many of the different things that are commonly contributing to hip breakdown. Now, as we look at these different slides, listen, the tendency is that none of us are taught how to sit properly. Here at the Limerick Chiropractic Center, we do walk our children through that process, that 3-step process of how to sit properly. And no, we know, because we've covered it before in different workshops on the health of the knee, we know that as we sit there with our legs crossed, it's not good for our knees, it's not good for our hips. If you ever wonder, what position should I be in, our feet should be flat on the floor. They should be at that 90-degree angle. We should be able to prop them up using just a little bit of a lift to take some of the pressure, off of our knees and our hips. But in the end, if we're not sitting properly, of course we're going to be torquing or putting stress into tissues that are supposed to be relaxed. And when we consider that, many Americans, they damage their knees, they're not kind to them, they cause them to break down, we realize that our body is set on a foundation. And the foundation of our hips happens to be our knees and our ankles and the arches in our feet. So when we start looking at the causes, it takes an awful lot to really appreciate what's at that root cause. What's that thing that has caused, our body to break down and not function properly? And like anything else mechanically, one area of breakdown or dis-ease, well, it causes the domino effect. It causes us to experience breakdown in a disease process in the joints above and below it. We are truly blessed with a wonderful system, a wonderful body, but in the end, we realize that everything in our body is interconnected. And therefore, when one joint is not functioning properly, well, other joints can't function properly. Now, when we talk about, how is it that we help ourselves, depending upon, what level of breakdown, what level of damage we've produced in our hips, one of the very first things to do is to start looking at some of the very simple stretches that are out there to help to stretch the muscles, the tendons, the ligaments, to make sure that the joints are capable of moving properly. We've talked about how, when we sit, it's the new smoking, because it causes the muscles in the front of the legs, our quad muscles, to tighten up way more than they're supposed to. And it causes the hamstrings, the glute muscles to actually weaken over time. But that imbalance, well, that throws us into all types of reactions that our body goes through. So as we look at some of the very simple, some of the very easy stretches that can be done. In yoga, the child's pose. As you can see, it's simple. It is a relaxed position, but it helps to lengthen tissues out. The cat-cow pose, where as you're raising your head, you're dropping your belly. As you drop your head, you're raising your belly, you're arching your back. There's numerous parts of the system that this helps to strengthen and stretch and mobilize. Let's recognize that as these tissues are being affected, they're affecting all the other tissues around. Now, one of the things that I absolutely love about these two stretches is that they're simple, they're easy. You need no other equipment other than just to simply get on the floor. If you do need a yoga mat in order to cushion your knees, in order to cushion your legs, obviously do so. But there isn't any type of special type equipment. In fact, these next two exercises, yeah, you could use a yoga mat, but you don't have to. One exercise is the figure 4 stretch. This is a powerful exercise that will, and it is designed to stretch the hip joint. It's going to stretch those muscles. It'll stretch the capsule that happens to be around the joint itself. And oftentimes, as patients do this, they come to discover how limited the motion actually happens to be. And as you can see with this young lady laying on the ground, the pressure is going to be applied towards the knee, where the knee is going to be driven down and away from the hip. And as we do so and just lightly stretching that out, you're going to feel the stretch in that joint capsule, in the muscles that are along the front of the hip joint itself. Now, this other example, the Warrior 2 pose, is just absolutely fantastic. You know, this works numerous body systems. And in fact, regardless of who you are, we're capable of assuming this position and getting into that place where we're capable of stretching and rotating those hips in order to lengthen out the tissues. Now, as we talk about it, we're going to talk about the next steps. For some of you, listen, just doing the stretches is going to be a really big deal, particularly if, in fact, the body's inflamed, if the tissues have been beaten up. And if you're a patient at the Limerick Chiropractic Center, you know, you're able to ask us about if, in fact, these exercises are safe for you, if, in fact, these exercises are a good idea for you. If, in fact, you're not a patient at the Limerick Chiropractic Center, I'm not your doctor. And in turn, as you're going to hear, one of the very first things is to make sure that you're getting checked to ensure that these are the most appropriate exercises and stretches for you. Now, with that being said, yes, we're going to step into the exercises. It's not enough that we create the mobility, we create that flexibility. We want to create that strength. And one of the things that we're going to be utilizing is the squat. Now, I love utilizing the squat as far as a mobility exercise and a strengthening exercise. You can do that sumo squat, which allows you to drop deep down and just sit with your hips really, really low. It's a wonderful way of stretching out the hips and the pelvis. Now, we're capable of utilizing that same action and that same activity as a strengthening process by going through and repeatedly doing body weight squats. Now, you're going to notice up here, there's a do and a don't. If, in fact, you're going to be performing these exercises, you want to make sure that you're doing them technically correct. So you're targeting the right tissues in order to strengthen. And the wonderful thing about the squat is that you can ramp up. You can increase the intensity of this by simply using different things that you already have around the house. The individual has a weight in hand, but let's just imagine you have a gallon of milk. Well, guess what? That gallon of milk, it's going to be about 8 pounds. That's going to give you a ballpark. Isn't it a wonderful thing that, you know, as we have these things in the household, a gallon of water, we're capable of utilizing them in order to ramp up the intensity of what we're doing. We don't have to find new and different things to do. We're capable of doing things that using things that we already have. Now, eventually, yes, you can do weighted squats. You can do front bar weighted squats. You can do over the shoulders. I am going to encourage you to ask the question, is this the right thing for me to do? Everybody happens to be at a different point in time. Everybody happens to have different injuries and damages, different subluxations and breakdown and decay. And in turn, we want to make sure that when you do these things, they're the most appropriate thing for you to do. In fact, making better choices is probably one of the biggest things that each and every one of you can do for yourself, because we are what we eat. And either we are picking and choosing things that are going to build the body up and grow it stronger and healthier, or we're going to pick things that are going to actually break our body down. Now, when we talk about breakdown, one of those things happens to be choosing inflammatory items to consume, whether they're foods, whether they happen to be things that we drink. Regardless, the choices either drive our body into an alkaline state or into a more acidic state, which is going to create more inflammation. Now, I'm going to encourage you. You want to look and investigate to know what those better choices are. Processed foods are largely going to be inflammatory in nature. They use really bad seed oils in their production. Oftentimes there's milk and dairy in there. There's gluten products in there that cause more inflammation to be created within our system. And there's a ton of books. If you desire, you can invest in looking at different anti-inflammatory diets. And let me clue you in. These are really guidelines on how to package and combine different foods together that are just better choices to drive the body in the direction that you want to go in. But the first thing is that you need to make sure what's at the root cause of the problem. You know, the last thing that we ever want is for you to waste time in the process, doing things, making changes, and it not being exactly the right choice. You know, let's think about it. If you take your car over to the garage and you ask your mechanic, hey, listen, you know what, it's pinging a little bit. It's not driving real smoothly. I'm not quite sure what's going on. Can you take a look at it? And instead of taking a look at it, he goes, well, let's try this. Maybe it's replacing a part. Maybe it's putting an additive into the gas tank. I don't know. But what I do know is without him checking it out, without him doing the diagnostics, it's called a guess. Which means that in the end, we're wasting time, we're wasting efforts and monies in order to treat something that we don't know exactly what it is. So in turn, the very first thing that I always recommend is just simply get the system tested. Do the diagnostics. Make sure that you're getting checked by a chiropractor and having that complete evaluation to ensure, well, why is my body doing what it's doing? Maybe the arches in my feet are broken down. Maybe I have a subluxation because of what's happening in the lower part of my back, and well, my hips aren't just holding their position the way they're supposed to. Maybe I've had long-term damage over time, and I do need to change my diet, balance my body. Maybe I need to rehabilitate with utilizing different exercises or utilizing a product like the shockwave therapy to strip away old scar tissue. In each one of these cases, the very first thing is to simply get checked. Because by checking, we know. By checking, we know where that starting point is. By checking, we know what the journey is supposed to look like in order to get you back to that place where you're able to say goodbye to hip pain. I'm Dr. Joseph Baker from the Limerick Chiropractic Center.